So welcome. I'm Dr. James Weisberg. I'm a pain psychologist and associate professor at the University of Alabama, Birmingham, and the secretary of the board of the Southern Pain Society. Here with me today is Dr. Jonathan Cole. Dr. Cole is a board certified clinical health psychologist working in private practice in Lexington, Kentucky. He's also the current president of the Kentucky Pain Society and a former board member of the Southern Pain Society. He specializes in chronic pain, sleep, and bariatrics. Thank you for joining me today, Dr. Cole.
Thank you, Dr. Weisenberg.
We're excited for your upcoming talk on sleep and pain at the Southern Pain Society's virtual meeting in March. Can you tell us a bit about your experience in the field of pain medicine as it pertains to sleep?
Okay. Well, I'm a clinical psychologist by training, and I received specialized training in health psychology. When I first started doing pain work, it was actually in graduate school. I trained in Chicago, and I trained at the Pain and Rehabilitation Clinic of Chicago. And that was an interdisciplinary program that we'd probably call that more functional restoration programs like now, where you'd stay like 4 weeks, and it was an intensive 40-hour-a-week program that was back in the 90s, many years ago. But I was starting to do, the more I did work with pain, chronic pain, the more I noticed almost all my pain patients had sleep disturbance.
Mm-hmm.
So insomnia. That was a big problem. People going and staying asleep. Also noticed that patients who had obstructive sleep apnea, who were taking perhaps medication that slowed the respiration down for pain, but they were having problems tolerating CPAPs. And actually, my first delving into doing more working with pain patients and sleep was developing a CPAP tolerance protocol for pain patients who were particularly on opioids. They could tolerate their CPAP, so it was safe for them to take chronic opioids as well as in addressing their sleep apnea. So I started working with that. Then I got more and more. I got trained with that and got actually hired by a hospital system to take over their pain and do the behavioral aspect of their sleep aspects. And so I worked with sleep protocol and found that there was a very strong connection we're finding more and more that between pain and sleep. And actually found that actually lack of sleep increases pain. And by treating the sleep disturbance, we can actually improve their functioning and reduce their pain.
Can you maybe comment on that point just for a moment? Because a lot of people think about about it being a unilateral relationship, that pain causes difficulties with sleep. You just mentioned sleep causing difficulties with pain. If you could just maybe take a moment on that.
Yes. So the biggest issue is a disruption in deep sleep or delta sleep. So I'll go more into this detail with the types of sleep you go through, but delta sleep allows you to feel well rested, allows you to heal. Anything disrupting delta sleep is going to cause the person more fatigue, but also it's going to increase pain sensitivity. You can actually have sleep-induced hyperalgesia. That's actually basically increased pain sensitivity due to lack of quality sleep. And when I first started doing this, I thought it was more pain was affecting the sleep and having a greater impact on sleep. But what we found, and subsequent studies have found, that actually sleep has a greater impact on pain than pain does on sleep. And so that actually changed the way I practice, because in the way I used to practice, we try to treat the pain first, and then they're still having problems sleeping, we address the sleep. Now I address the sleep immediately. So
I'm sure this is a topic you're going to discuss much more in your
yes.
lecture coming up in March. That's
Yes.
fascinating. I'm looking forward to hearing more about that.
Thank you.
Why is this so timely right now? Why is the topic of sleep in pain medicine, pain management so timely at this point?
Well, a lot of people working from home, not working, their sleep schedule is interfered with. And so people doing virtual meetings, maybe not getting enough sunlight. And so a lot of people's sleep have been disrupted due to our current environment. And that they're already having problems sleeping because they have chronic pain. And so addressing that can actually, that can amplify their pain perception and also their ability to get better, to rehab and improve their function.
Okay. Is there an overall message for those attending your talk that you'd like to share?
Well, I guess overall message would be that there are very effective treatments for insomnia, and actually the most effective treatment for insomnia is a behavioral treatment more than medication, which we'll go into. And it's, I think it would be important for almost all pain providers to look at someone's sleep, make sure, see how their pain is impacting their sleep and vice versa. They don't have to be a sleep specialist, but they want to. That's one thing they want to kind of keep an eye on, because that's going to affect their pain and affect their function.
I can say in my own clinical practice with pain patients, I probably refer about 10% of them to the sleep center for sleep evaluations, and probably another 15 to 20% already have a diagnosis of a sleep disorder, as you were mentioning, either sleep apnea and or insomnia.
Right.
Is there anything else that you would like to add to what we've discussed above?
Well, just that we'll go into certain things that people may not have thought about. So, for example, there's been a larger move to reduce opioids and reduce the amount of opiates, but realize that one of the side effects of opiates, if someone has restless leg syndrome, that may be helping the restless leg syndrome. So when you reduce their opioids, they may have restless leg syndrome that may come out. We may have to give them different medicine for that, or address certain things for this. But we're going to try to address more specific things and things they may not have thought about in relationship with sleep and pain. And this will be obviously addressed to the pain practitioner, but how they can get the assistance they need and help their patients.
Wonderful. Well, we're so much looking forward to your talk on March 13th at our virtual pain meeting. Thank you once again, Dr. Cole. Appreciate it.
Thank you.